Good day. I am a physician. Some medication combinations are genuinely and silently dangerous to mix together. If you are over 65, there is a 40% chance you take 5 or more daily medications. Each of those drugs was likely prescribed individually by a different specialist over the course of several years. Nobody has ever sat down to look at the biochemical warfare happening when all of them interact simultaneously. Today, I am opening your medicine cabinet and showing you the combinations that can rapidly become fatal. This video is for educational purposes only and does not replace professional medical advice from your doctor. We assume that because a medication came from a pharmacy, it works safely in complete isolation from others. This is a fatal misunderstanding of human pharmacology that costs over 100,000 preventable lives each year. When multiple chemicals enter your digestive system simultaneously, they compete for the exact same enzymes and metabolic pathways. One pill can mathematically double the toxicity of another while simultaneously neutralizing the effectiveness of a third drug. Today, we specifically examine the hidden bleeding risks lurking inside the most commonly prescribed medication combinations. In geriatrics, we reveal the massive danger of a seemingly innocent breakfast juice that many statin users drink every morning. We cover the single most important annual habit you must adopt if you want to safely manage polypharmacy. Number 7. The polypharmacy crisis. Adverse drug interactions cause over 100,000 preventable deaths every year in America. The medical community has an official clinical term for taking 5 or more daily medications, which is polypharmacy. The average senior currently takes 7 separate prescription medications, prescribed by multiple physicians across separate medical specialties daily. This is not simply an administrative inconvenience. It is an active and measurable public health crisis affecting millions. Adverse drug interactions cause over 125,000 preventable deaths every single year in the United States. That makes it the 4th leading cause of death, alongside cancer, heart disease, and respiratory failure in mortality data. As we age, kidneys filter toxins more slowly, and liver enzymes become increasingly burdened by multiple competing drugs. Prescribing a new pill to treat the side effect of an existing pill creates a toxic cascade effect. That cascade eventually overwhelms the body's metabolic capacity to safely process every chemical entering the system simultaneously each day. Do not accept a new prescription without asking your physician to review your complete current medication list that day. Number 6. Warfarin plus aspirin plus ibuprofen. Hematologists call this triple combination a chemical death sentence if mismanaged. When you take warfarin, add daily aspirin for heart protection, and then swallow ibuprofen for joint pain. Act immediately. You are simultaneously blocking platelets, dissolving clotting proteins, and degrading your stomach's protective mucus lining at the same time. This catastrophic triple combination creates a bleeding risk so severe that doctors call it the triple pharmaceutical threat. You may feel nothing unusual until the moment you collapse, because the bleeding begins silently deep inside your gut. Never take any NSAID, including ibuprofen or naproxen, while on any blood-thinning medication without explicit physician approval. If you experience back pain, joint pain, or headache while on warfarin, call your pharmacist before taking anything. Acetaminophen, taken carefully at the correct dose, is generally the only analgesic considered safer alongside anticoagulation therapy today. Show your complete medication list to your cardiologist before touching any over-the-counter painkiller at any pharmacy ever. Number 5. Statin plus grapefruit. 1 glass of grapefruit juice can turn your cholesterol pill into a toxic overdose. It sounds like an urban medical myth, but it is a thoroughly documented and mechanistically understood pharmacological interaction. If you take a cholesterol-lowering statin like atorvastatin or simvastatin, never drink grapefruit juice on the same day. Grapefruit contains chemical compounds called furanocoumarins that block CYP3A4, the enzyme your liver uses to break down statin. Because the statin cannot be properly metabolized, it rapidly accumulates inside your bloodstream to catastrophically toxic concentrations. A standard safe daily dose suddenly becomes a massive toxic overdose that your body has no mechanism to clear. This toxic accumulation triggers a condition called rhabdomyolysis, where your own muscle tissue begins to physically break down. The breakdown products of that muscle tissue then chemically poison your kidneys, potentially causing acute and irreversible renal failure. Rhabdomyolysis begins with severe unexplained muscle pain and dark cola-colored urine and requires immediate emergency hospital treatment. If you take any statin, eliminate grapefruit and grapefruit juice entirely from your diet without any exceptions at all. Number 4. ACE inhibitors plus potassium. This combination can cause sudden cardiac arrest without any moment of prior warning. Millions of patients take ACE inhibitors, or ARBs, like lisinopril or losartan, to manage blood pressure effectively each day. These drugs protect the heart powerfully, but dramatically alter how your kidneys process the critical electrolyte potassium internally. They force your body to retain potassium, which means your blood potassium levels are already running systematically higher. If you then arbitrarily add an over-the-counter potassium supplement for leg cramps, you trigger a lethal interaction instantly. The resulting condition, called hyperkalemia, is a dangerously elevated blood potassium level that electrically destabilizes your heart rhythm. This does not cause a slow or gradual decline that gives you time to seek medical attention safely. It causes sudden, immediate cardiac arrest that can occur without any warning symptom whatsoever in the moments before collapse. Salt substitutes sold at supermarkets are packed with potassium chloride and carry the exact same dangerous interaction risk. Never take potassium supplements and never use salt substitutes without explicit physician clearance if you take any ACE inhibitor. If you find this science-based breakdown helpful, please click subscribe and tap the notification bell right now. It only takes absolutely 1 second, but ensures you never miss the next video in this series. Number 3. Metformin plus alcohol. Heavy alcohol on metformin can trigger a metabolic collapse with a high mortality rate. Metformin is arguably the most successful and most widely prescribed diabetes medication in the entire history of pharmacology. But its metabolic mechanism requires absolute respect and a complete understanding of what disrupts it from functioning safely. Metformin aggressively alters how your liver simultaneously processes both glucose and the metabolic byproduct called lactic acid. If you take a high metformin dose and engage in heavy alcohol consumption, your liver becomes overwhelmed immediately. Alcohol biochemically suffocates your liver's ability to clear that lactic acid from your bloodstream at the required rate. The lactic acid then rapidly builds to dangerous concentrations, driving your body's blood pH to fatally acidic levels immediately. This triggers a condition called lactic acidosis, which is a horrifying systemic metabolic collapse with a high mortality rate. Lactic acidosis develops rapidly, and patients who do not reach emergency intensive care within hours may not survive it. If you take metformin, limit alcohol to an absolute maximum of 1 drink per occasion and never binge drink. We have identified the lethal combinations and the breakfast juice that silently turns a safe pill into a poison. But what if you are taking your medication correctly yet swallowing it at the entirely wrong biological moment? Number 2. Blood pressure pill timing. Certain blood pressure drugs taken after breakfast absorb 40% less effectively. Pharmacokinetics dictates not just what a drug does inside you, but precisely how and when it enters your system. Certain critical blood pressure medications, including perindopril, lorcanidipine, and valsartan, are highly sensitive to food in the stomach. If you swallow these pills immediately after a large breakfast, food in your stomach drastically reduces their absorption rate. The reduction can be as severe as 40%, meaning you get a dangerously smaller dose than prescribed. You swallow a 10 milligram tablet, but your cardiovascular system receives only a 6 milligram dose that morning. You remain hypertensive and vulnerable to stroke throughout the entire day, not because the drug failed to work. You remain at risk because no one ever told you these specific medications require a fasted or near-fasted stomach. Ask your prescribing physician or pharmacist specifically whether each of your blood pressure medications requires an empty stomach. This one conversation, taking less than 2 minutes, could prevent a stroke caused by a correctable absorption error. Number 1. The annual brown bag review. This single 10-minute habit reduces drug interactions and hospitalizations by 30%. The solution to the polypharmacy crisis does not require advanced medical testing or expensive specialist appointments to execute. Once a year, you must perform what pharmacists and geriatricians call the annual brown bag medication review. Take every single prescription bottle, every over-the-counter painkiller, every herbal supplement, and every vitamin you consume daily. Put every single item physically into a bag and bring it directly to a qualified clinical pharmacist near you. Force one highly educated professional to cross-reference your entire chemical intake simultaneously in a single focused clinical session. Studies definitively prove that this one 10-minute act reduces adverse drug interactions and hospitalizations by over 30%. 30% is not a marginal improvement. It is the difference between a dangerous year and a safe year. Do this every year without exception, especially after any new prescription is added by any physician to your regimen. Your pharmacist is the most underutilized and most accessible medication safety expert in the entire modern healthcare system today. The pills scattered across your kitchen counter are not individual actors. They are an interconnected chemical web inside you. Never assume a drug prescribed 1 year ago remains perfectly safe alongside a new drug prescribed this morning. Take a photograph of every single substance you swallow, including supplements, vitamins, and over-the-counter products purchased today. Lay your complete pharmaceutical inventory out for a clinical pharmacist at your very next available opportunity this week. Demand a comprehensive and honest review of all potential interactions across your entire current medication protocol, without exception. Being chronically over-medicated is not an unavoidable requirement of growing older. It is a failure of system management. And it is a failure that you now have both the knowledge and the power to correct immediately. Subscribe, tap like, drop a comment below, and share this video with someone you love.